And of course, it just wouldn't be my content if I didn't have to follow a great success story with a pain in the ass story. This is addressed in the book, kind of in multiple places, but it is. And it has to do with, once again, one provider had the patient on methadone, oxycodone, and Lyrica, which can be a very good pain plan for the right person and the right reason. Now the patient retired, it took over by an NP. The NP took all the meds away with no pain relief in place. Any suggestion? This is Marianne. Marianne, how do I give you advice when you're being treated wrong? The first and most immediate advice is there's absolutely nothing holding you there if that's the way they left. It's time to begin looking immediately. It's time to find out if Kratom can at least help your withdrawals. You might ask your provider for a clonidine prescription, those 0.1 milligram tablets, and give you 30 to 60 to try and get you over the hump using that alpha blocker response to withdrawal symptoms. Something along that line to get you over the now. But the number one thing that I would say to the provider that you're currently seeing, and by the way, another great person who to buy the book for. Just remember, you can buy the book you can go to drmikesays.com. You can buy a donated book for a doctor, whether they're a doctor who needs to be taught or whether they're a doctor that needs to be encouraged because they're doing a good job. This will serve either function, okay? So you go to you buy a donated book, and you give me the name and address of that doctor, and then you pay the lower price because you're donating a book to the doctor, and you can do that at drmikesays.com. Now, further, you have no barrier moving you to someone else, so go start moving, okay? You may need to go to a pain clinic that does methadone. Hold on a second. I didn't say go to a medication-assisted therapy, but many methadone clinics also have pain providers because very few primary providers are going to feel comfortable writing for methadone. Even when I write it for very low dosing, 10, 20 milligrams tops twice a day, okay? But you were on a different plan, and you need to see if you can find someone that will give you the plan that you were on. And the great thing is the book tells you how to do that, so get your own too. Love you, no buts.